Sedation is kind of a broad word, and it can, in my mind, it can involve everything from just a calm demeanor on the part of the staff and the dentist and the receptionist talking to the patient just to make them feel relaxed, to different levels that would increase the level of involvement on our part in terms of nitrous oxide laughing gas, which we have and use a fair amount, but that's not applicable to patients that have a moderate or a high fear. So we can augment that or increase their level of comfort by adding oral medications, just a small pill that they would take in advance of their appointment, even sometimes in advance of coming into the office. That's not at all uncommon for us to do that because people are even afraid of that. So that makes them relaxed, and it's kind of funny because a lot of times their companion that brings them in will say, "Can I have some of what you gave her?" Because that seems like pretty good stuff. So, we, depending on the patient's level of anxiety, will determine with the patient and let them decide with us in terms of whether they think nitrous oxide alone would be enough or the oral sedation, which I'm not a huge fan of. I've done a lot of it, and I found that it was really effective for some people, but there's a large population out there, autistic patients that don't have control over themselves, mental illness type patients, that need IV sedation. So that's really ultimately utilized for patients that just don't want to know what's going on. Some of these patients will have very lengthy appointments, several hours long in the chair, either because they're anxious or because they just don't want to be aware and they don't want to be jittery for 7 hours, but they want to get a lot of things done. We have businessmen that are CEOs of companies that come in for sedation just because they can't get away from their business. They're so important, but they can take one day off and come in and get everything done. And then other patients that need, a number of appointments to get things accomplished depending on the severity of their dental problems.